The NICU is a 101-bed unit, so quite large, one of the largest in the country. We're already at a place that provides top-notch clinical exposure and training, but really taken the program to the next level, and that is really being strategic with career development and mentorship, and really allowing our fellows to grow here during their 3 years, not only in their clinical training and neonatal education, but really to start the process of building what it is that they want to do long-term within their career.
Our ultimate idea is that we want to have fellows who are capable of a private practice or an academic career in whatever area they want to excel in, that we can provide the foundation for that.
I think what sets the University of Louisville Fellowship Program for the NICU apart from other places in which I have been a part of and have been exposed to is the training is different in that it seems much more one-on-one. It is very much a welcoming and collaborative type environment.
There are so many things that make this an excellent training program. Not only do we have the ability to become excellent neonatologists because of the rigorous clinical experience that we receive, but we also have the ability to learn from attendings who are compassionate, kind, care about their babies, and want us to be the very best future natologists that we can be.
Our catchment area is so wide, so large that we see quite a bit of pathology, and then we have all of the additional things that are rare and not seen often, but that fellows would get exposure to.
Our fellows have the opportunity to take care of babies with congenital heart disease before they go to the OR. In addition, our fellows are the primary point people for our ECMO runs as well, and so I think those are two unique, awesome clinical experiences.
A lot of NICUs now are transitioning to having like their own cardiac ICU, and that's one thing that we still get to experience here is taking care of the heart babies here in the NICU, which I think is a very unique experience.
All of the repeat C-sections that have anything go wrong, or our premature babies, we get that delivery room experience rather than somebody else getting the delivery room experience, and then we get to take care of them after that.
So Norton Children's Hospital is a level 4 NICU, which means that we not only provide basic services for newborns and neonates in general, but we also provide surgical services, and we provide all of the subspecialty care that's involved. Two of the things that I'm really proud of that I think set our neonatal fellowship apart are, one, the ECMO program, which is very unique to us, where we can take care of babies on ECMO within the unit. And the other piece is that collaboration with the cardiology team. In many other level 4 NICUs, the cardiac team is completely separate. But this collaboration with the Norton Children's Heart Institute has been a wonderful and valuable asset to us. And our fellows have certainly appreciated being able to take care of a wide range of patients with cardiac lesions.
Every person is integral to our team, from our students and our fellows to our nurse practitioners as well as our attendings, and that includes the broader team of our healthcare system. And I really feel very strongly that the reason that we're all successful in what we're learning to do and what care we give is because of that teamwork culture.
We have a very uniquely collaborative relationship with our fellows. It's very back and forth. You know, we have separate patient populations, but they're intertwined all at the same time. If they have a very sick patient, we're willing to help deal with whatever they may need, and vice versa.
We work very closely with each other. Everybody's always got each other's back. We all kind of focus on the clinical aspect of the NICU. We're all on the same team, all working towards the same goal. And whenever there's an issue or someone needs to step in to help, there's really no hesitation. We're always there for each other.
On an individual basis in the unit, we want to make sure that the fellows are okay and doing well, and we'll stop to inquire about their wellness. We want to make sure that they are safe going home. We want to make sure that we're not overextending their work hours.
It's really nice because the program puts a high emphasis on our wellness and definitely takes time out of the unit to kind of make sure that our mental health is okay.
The program has involved me in advocacy in so many ways. Advocacy is something that's really important to me. And so I've had the opportunity to actually pursue my master's in public health for that reason. My goal through both that master's and through some of my fellowship research endeavors are to look into things that affect infant mortality, in particular involving Black infant mortality. I've been able to sit in on meetings for the maternal mortality collective that's here in the state, and just so many different things.
We have a variety of programs that have been put in for fellows and for residents to enhance their educational experience.
I have had the opportunity to participate in the Health Professions Education, or HPE, certificate program. I have aspirations to work in academics for the duration of my career, and doing this program has allowed me to hone my teaching skills and also has given me a lot of opportunities to improve my scholarly activity, which is a medical education project.
The amount of support we get from our attendings is really amazing. They're always there for you if you need them. They give you autonomy when you need it, but if you need help, they're right there by you, which is pretty awesome.
We really work to make sure that the fellow feels supported all around. Fellows are matched, and it's a lot of input from the fellow on trying to find a mentor that really complements not only their professional life, but their personal life.
Our fellows meet together for an educational session every week. Tuesday afternoons are dedicated. We have 2 hours set aside for fellow didactics, so that's protected time from the unit where they come over together. We do a wide range of sessions together, whether it's board review, kind of traditional didactics, more adult learning driven, flipped classroom style sessions, and other sessions that are led both by faculty within our division and faculty outside of our division.
One of the things that makes our program special for me is that we have the opportunity to be at a level 4 NICU that not only receives transports from around the state as well as the state of Indiana, but we also have the opportunity to attend deliveries. So we're connected to a delivery center and receive transports, which is very unique to a level 4 center.
I really love just to find opportunities and different ways to explore the city. There's so many different things that I can walk to, different parks, different restaurants.
Louisville is a great place to live because of the unique, diverse culture, not only a little bit of blending from southern ways, but a little bit of that northeastern vibe.
Louisville is a great city. It's definitely a foodie city. There's a lot of different restaurants, a lot of great restaurants around the city.
I love to be outside. There are awesome bike trails, lots of city parks that my family and I love to visit.
Bourbon, basketball, and music is always big here. And then, of course, Derby and Oaks. Oaks is probably one of my favorite events. My family and I, we go every year.
I'm going to be well prepared when I go out on my own. I don't really see there being many things that I at least haven't come across in fellowship due to the volume and the amount of different things we get to see.